Hi everyone, how's it going? This is Dr. Mehta over here. Today I wanted to take a few minutes to talk about 10 common questions I get from patients in preparation for their EMG. So let's go. The first question is, well, what does EMG and NCS stand for? So the test is actually split up into two parts. The first part is the NCS or nerve conduction study, and the second part is the EMG or electromyography. Now, in the first part, we're assessing the health of the nerves in our arms or the legs to see if there's any issue with nerves there. So some things that people may have heard of is peroneal neuropathy or carpal tunnel syndrome. That's an issue with the nerves in our legs or in the wrists. And so the NCS is what helps us diagnose that part. The second part is the EMG or electromyography, where we sample a few muscles in the arms or in the legs, and this actually keys us in to say, hey, is the problem coming from the nerves in our neck or is it coming from our back? So is it more of a radiculopathy that we're looking at? The second question is, well, does the test hurt? Now, this is not a particularly painful test, but it's not the most pleasant experience as well, right? So for the NCS, we use this little small probe that sends some small jolts to test the health of the nerves. And patients usually say that this feels kind of like a TENS unit that they use. For the EMG, what we're using is a small acupuncture-sized needle that you can see right here. And that's what we're using to sample some of the muscles to see the health of the nerves in the neck and the low back. The third question is, well, why do we test the asymptomatic side as well as the symptomatic side? Now, even though we have normal values for the general population, the best controlled study is when we use the individual as their own variable, right? And their control. And so when we test your asymptomatic side, we can say, hey, what's normal for you? And so when we test your symptomatic side, that gives us the best idea of, hey, this is truly normal or abnormal. For example, some patients may lay in the normal range, even on their symptomatic side. But if there's a significant difference between side to side, then we know even though in the population they're considered normal, for them, that's truly a pathology. Next question, can I take medications beforehand? Yes, that's a great question. You can take basically all of your medications beforehand, even blood thinners. Patients usually ask, well, if I'm taking nerve pain medicine like gabapentin or Lyrica and you're testing my nerves, how are you going to know the health? And these medications are actually responsible for how we process nerve pain, but do not impact the actual physiological function of the nerves. So you're welcome to take any of your medication before this exam. In a similar regard, you do not need to fast or hold off on eating before this test as either. The next question is, well, how long does this test take? Test usually takes about 40 to 50 minutes, give or take, depending on how complex the patient is, but that's a good average. How do needles in muscles help to show what's going on with my neck or my back? That's a great question. So again, the spinal cord has the nerves in our neck and our low back, and then that has roots. And then those roots, like C6, C7, for example, those actually are at the end of the day, ultimately responsible for controlling movements and muscle movement and function. And so that's why when we test muscles in the neck or in the arms or the legs, we're actually able to key in on the health of the nerves in the neck or in the low back. The next question is, well, what does the doctor see on the EMG or the NCS screen? And that's a great question. So here we have an example of a nerve conduction study. And what we're looking at, this is actually of someone's leg. But what we're doing is when we stimulate the nerve or give a small jolt, we can see a couple things. We can see how long it takes the nerve to react. So that's the myelination, which shows the speed of the nerve in one aspect of health, and then how much of the nerve, so how robust is that nerve when it does react. And that also, these two factors help us kind of really get an idea of the health of the nerves in the legs or the arms. The other thing that we can see, which I don't have a great picture here, is when we're doing the needle portion, we're able to see, well, how healthy is the muscle recruitment and the muscle activity. So when the nerve sends electrical activity to the muscles to actually fire, how healthy is that signaling, right? And how healthy is the response? How is the nerve working? How is the muscle working? How are they working together? Is the nerve really struggling and so the muscle has to pick up some slack, or is there an issue with the muscle and so the nerve has to work hard? And those are all factors that we're able to assess based on the NCS and the EMG. Why can't I wear lotion before my test? That's a great question. So lotion can actually negatively impact our nerve conduction study. It actually affects the speed of the nerves. And so we recommend not wearing lotion on the day of a test. Similarly, cold weather or cold body temperature can actually falsely slow down the speed of the nerves. And so what we actually keep in the room is a blow dryer. So if the patient's limbs are too cold, we can warm up their arms or warm up their legs. What clothing should I wear? So similar question, right? We want to be able to, if we're doing your arms, we want to be able to get to the shoulder region and do the whole arm. So we recommend like a loose fit t-shirt or a short sleeve t-shirt so we can roll it up all the way to the shoulder. And then otherwise loose fit pants or shorts if we're doing your legs because we need to get to the mid thigh region. Obviously, if you don't have these available, no big deal. We can always give you a gown to change into. And the last question is, well, are there any side effects? Now, there are not any major side effects from this test if you're doing it with a trained professional. Sometimes the test can be a little uncomfortable for patients, so they have a little bit of pain afterwards. Or what they have is a little bit of soreness from the needles. So we recommend going home, icing it for a little bit. And if you really need to, you can take a Tylenol or ibuprofen. But most patients are fine by the evening.